Welcome back as we continue our discussion on why a growing number of older adults are struggling with addiction. It's important to highlight one of the key factors that plays a significant role in this phenomenon: over-medication. Seniors are the heaviest users of prescription drugs in Canada, with many taking 5 or more medications on a regular basis. This often leads to adverse drug reactions and interactions, which can further compound health problems and increase the risk of addiction. Marilyn, tell me about the problem of polypharmacy and why it has been growing enormously in recent years. We're talking 5, 10, even 15 prescriptions some people are taking on a daily basis.
Well, certainly with older adults, they have so many comorbid conditions, and often, with certain conditions, they have very legitimate pain. And, lack of treatment for pain creates, disability and poor functioning. And so there are some people who really need them. And then there are other co-prescribers that people go out to, and one doesn't talk to the other. So it's easy to get multiple prescriptions.
I think that, Canada's a little different. I work also a lot in the United States. The state of Florida, very strict now. Used to be a pill mill. You could get anything at any time. Now they're only given guidelines per month, and that prescription has to be, you have to re-see a doctor physically or via Zoom to get a prescription for it. The reality, again, of all these people, people are hypertensive, there's a multitude of things that can happen. The amount of people taking antidepressants but still drink every day is preposterous. You're drinking as suppressant and you're taking a medication that will work optimally with no alcohol in it. Mm-hmm. So pain medication, I have people that have been on pain medication for 30 years. But at this point, now other things, because the ecosystem that is their bodies are starting to break down in different places. And that's where it starts to show very quickly. Some of them believe that, a drug addict lives on the street or at the corner or under a bridge. And no, a drug addict can be going to the Shoppers Drug Mart once a month to be getting his, drug dealers inadvertently are doctors. Mm-hmm. And they're getting overprescribed.
Mm-hmm. And I imagine, Chuck, it would be very difficult to wean someone off of 10, 15 prescription pills.
Well, it is, but one of the things that hasn't been said loud enough yet is that, unfortunately, your average GP, your average family doctor, is not well trained in addictions. They don't understand exactly how easy it is to get addicted or how to wean somebody off. And often they're overprescribed by accident because the pain, it was dealing with the pain properly for a while. All of a sudden, the person starts to get better, but they're still on the same amount of drugs that now start to addict them. And that's a huge issue. We need to get better training for our doctors.
Well, and the other challenge, and we kind of mentioned a little bit earlier, Dr. Kitamura, but how do you recognize when somebody has an addiction problem? Did they end up in the hospital because they're woozy from the drugs or because they have other medical conditions?
Yeah, well, there's a couple of ways it could go for people who are using opioids long-term. Most people using them long-term will have some degree of physical dependency, which means often there's a tolerance where the benefits start to wear off, and sometimes that leads to greater use and often prescribing higher doses, or there's withdrawal symptoms. Then there's the other subset of people who, related to their use, develop consequences from their use and misuse of the prescriptions and run out early from them and develop, for example, the medical consequences that let them have them present to hospital. And the symptoms of a substance use disorder, be it alcohol or other substances, are often quite nonspecific, right? It's the fall, it's fatigue, it's confusion. It might be related to a motor vehicle accident that happened. It could be the physical health sequelae. And again, those are often the conditions that get recognized and treated, but less so the addiction.
What does an intervention look like?
Well, I'm usually being called pre or post jackpot, like you've just described, a fall or a drunk driving charge or something like that. And sometimes we'll come in there and we'll start, I meet a family of concerned people and we start sort of disseminating information. And I often say, can you show me what their prescriptions are? And they'll go get them. And I've seen prescriptions coming from 5 different doctors. The pharmacy is giving from 5 different, so they obviously are not talking to one another. But what it looks like for the intervention is getting these people finally off of them. They're scared, they're petrified when they felt even the smallest amount of detoxing. they get very scared very quickly. It's my experience with anyone over 50, they do not like the discomfort of coming off of it. So they will go, they'll get in a car, they'll travel over the border to New York, they're crafty, people that want their drugs. And that's not all of them, it's just where some of them fall into. But I think that we are the most overprescribed populace on earth in Canada. Medically speaking, our pharmaceutical sales in this country per capita are off the chart. So clearly they're getting it. And he's very right here, because I know a lot of doctors that don't have an idea of what they're doing. I have friends of the doctor that told me it was one afternoon in med school that they talked about addiction. And they're coming in and presenting like this now. And opiates really build the tolerance quickly.
Yeah, I would say, though, that I think there is some changes happening. I got an email just this week, actually, with a collaborative initiative amongst all the Canadian medical schools with a comprehensive education sessions and modules about good opioid stewardship. So, and of course, with the tragedy of the opioid crisis over the recent years and deaths, it's garnering much more attention by everybody, right? By government, by patients themselves, by prescribers, and I'm hopeful. I'm hopeful that
you can be hopeful, but there's also another problem. When people don't get their candy, they'll go get it on the street. And it happens a lot more. Grandmas and grandpas are buying drugs on the street. That is a fact. This man in British Columbia will answer what I'm saying. It is just happening more than ever before.
Yeah, no, it's true. I mean, and I know one sad instances where a doctor did recognize somebody was addicted to the prescription and cut him off cold turkey. And what they went to the street and the very first time overdosed and died. It's a lack of training, a lack of understanding how the addiction works and how to properly deal with it.
All right, we'll be right back with more of the Zoomer. Don't go away.